Republican senators are pushing forward with their latest plan to repeal and replace Obamacare. The proposed plan from Senators Bill Cassidy and Lindsey Graham would give states, instead of the federal government, more flexibility on how to provide health care for their citizens.
The question is, at what cost? MTN's Kent Lutzen spoke with Senator Jon Tester earlier this afternoon on his thoughts of this last-ditch effort to repeal the Affordable Care Act. Kent?
Dennis, Jill, under a procedural rule, Republicans only need 50 votes to pass this new proposed health care plan. However, their deadline is coming up quickly. That's on September 30th in just 10 days. After that date, they would need 60 votes, meaning they would need help from Democrats. Pass the new bill is very concerning.
The truth is McConnell has already said, who is the leader of the Senate, there's going to be a vote next week. And I can tell you there is being a lot of pressure being applied to senators to try to get them to vote for this bill, even though it may be the worst.
I've never felt better about
the worst of the four bills we've looked at now, far worse than the previous three.
Tester said this bill would kick people off of their health plan, raise rates, threaten coverage for people with a pre-existing condition, and strain the Montana Veteran Affairs. President of the Montana Hospital Association, Dick Brown, agrees with Tester, adding that this bill would jeopardize many lives that are covered today.
First of all, there is no requirement on the states, if the money comes in the block fund, there's no requirement for them to put it in coverage. So with a lot of state budgets like Montana's worrying about other areas, there may be money distributed in directions that would not support what we're trying to accomplish here with coverage.
Another major concern for Senator Tester is the caps and cuts of federal funding for Medicaid, a move he says threatens rural hospitals, nursing homes, and care for disabled children.
If you're a great big hospital and you have volume, you might be able to survive this. But if you're not, if you're like a Cut Bank or a Roundup or a Big Sandy or a Chester, and the list goes on and on and on, you're not going to have that volume. And if that charity care goes up, it's going to put you at risk of closure.
Now, Tester said he joins a bipartisan group of governors from across the country that oppose this bill, one being Montana Governor Steve Bullock. Jill, Dennis?
Thanks, Ken. Tester admits the current health care system has its flaws, and he wants to work in a bipartisan way to fix Obamacare.